Hello everyone, welcome back to Ask Giri the Physio Show, Season 3, Episode 7. Today's topic is trauma-informed physical therapy practice. What does it mean? Who's this for? This is for both patients and physiotherapists. For patients, it's good for you to know how the physiotherapy clinics, some of them are at least trauma-informed, and what does it mean to you as a patient. And for physiotherapists, or physiotherapy clinics in town who are not trauma-informed, for them to know how you can be a trauma-informed physical therapy practice, what you can do to go about it. So that's the whole objective of this episode 7, Season 3, Trauma-Informed Physical Therapy Practice. Let's jump in right away. So what is trauma? According to statistics, North American statistics at least, they say around 85% of individuals in North America had at least one episode of traumatic experience in their lifetime, right? We all can reflect, we all can close our eyes and reflect, like what kind of trauma I went through in my life. Is it a mild one or major one, and how I dealt with it and how I'm dealing with it right now. So just a small exercise for everybody who's listening to this. So trauma is less about what happened to you than that one subjective experience about that, how they handled it. That's what trauma is about. And we're going to see the SAMHSA'S definition of trauma. Before seeing the definition, how I got involved in this is because our clinic, Insta Physical Therapy, is located on Avenue of Nations, we call it, 107th Avenue. And we've been in this area for the last 20 years. So we see people from all walks of life. And we see a lot of people from who born and brought up in Edmonton, who came from other countries, immigrants, culturally different, and also from refugees from different countries, and people who vacated the country due to natural disasters. And that's all called trauma, right? They underwent some kind of trauma. And then when you're dealing with the people with that kind of trauma, you might have to change your approach a little differently, and we have to be culturally competent and more empathetic, and to kind of take care of them, to provide care for them. That's how I got interested into that, and I did few certification courses on this, and I just completed my Healing Trauma Summit last 7 days, and I thought, you know what? What's a better opportunity for me to explain this to the public and the physios out there, so everybody can get benefit out of this. That is the whole point. Okay, let's see the SAMHSA'S trauma definition. What does SAMHSA stand for? They basically, it's a nice association. It's called Substance Abuse Mental Health Societies Administration. And you can check their website out. There's a lot of nice handouts and toolkits for the professionals and for the common people in their website. And their definition of trauma is basically, as you see in the slide there, it can result from an event or a series of events. It can be one big thing or one small thing or a bunch of small things. It can be anything you want. And this is experienced by an individual. It can be physical, and also it can be mental. It can also be emotional. Sometimes it can be life-threatening too. But that particular event or series of events cause adverse effects throughout your lifetime. Your functioning is affected, your mental, physical, emotional, spiritual well-being is affected, and they go through that quite a bit, right? So that's why we need to be careful about that, and then we need to approach it a little differently. Okay, moving on. The prevalence. You might be wondering, okay, what's the prevalence of trauma here? There's a big study. They used about 17,000 participants in the US. They done it on adverse childhood experiences. It's called ACE, they call it. They kind of, you see the study there, they kind of said there's so many of adults out there who underwent adverse childhood experience, and they go through a lot of difficulties in these areas, right? And which increases the health risk, the mental health risk, physical health risk, and also increases healthcare cost on the government, and also it affects the life expectancy, right? So what are the different types of ACE or adverse childhood experience one can go through, right? And then we can classify into abuse, which can be a physical, emotional, also sexual abuse, and also neglect. It can be physical neglect or emotional neglect when you are a child. And household dysfunction. It can be mental illness in the family with a dad or mom or uncle or brother. It can be incarcerated relative in your family, or mother or father or uncle treating you violently when you're a child, or substance abuse in the family, or yourself, or the brothers or sisters, and the divorce from the past. So these are the various areas one can experience the adverse childhood traumas. So moving on, what are the types of trauma? There's so many types of trauma there. Some of them I've listed there. As we discussed earlier, it can be physical, sexual, or emotional abuse, childhood neglect, living with a family member who has mental health issues or substance abuse disorders, it can be there, or serious medical illness or diseases. It can be for you or for your family members, and you see them suffering day in and day out, and that can cause a lot of trauma to yourself as well. And things like wars, right? We have so many wars happening in the world every few years or so for so many reasons, and then how that is tearing apart people, how many refugees are forming in each and every war, and displacement of people leaving their homes and everything out there. And we had the Syrian war, and Canada took a lot of Syrian refugees as well, and also now it's Ukrainian war is going on, and Canada has already opened the borders for the refugees. And these refugees, they're coming into the country, and you're going to see, as a physiotherapist, they're going to be walking into your clinic, and then how are you going to treat them? How are you going to approach them a little bit differently? So that's why this episode is all for. And wars, combats, and also civil unrest, and a lot of violences in the community. We had treated people last year, so many people from South America came from the countries, a lot of violence in that area, and gang fights, and a lot of violence in the countries as well. And catastrophic losses to the people or the home and the belongings, that's important. Poverty and discrimination. Okay, it can be racial discrimination, it can be social discrimination, whatever it is, and that also correct a lot of trauma. As I said, it can be one big event or series of small events that can happen. Medical trauma. You must be wondering, what is medical trauma, right? And we all can come across patients in our assessment explaining the trauma they went through, from appointments to appointments to appointments, and nobody could diagnose the problem, how they were being thrown around from one office to the other offices, given medications which causes so many side effects, or failed surgeries, or a failed care or rehab care after that, and how much of their life has changed because of that. So that's all kind of medical trauma. And also, don't forget, a motor vehicle accident, it's also a trauma, and we see a lot of those people. Workplace injury is a trauma. It's not, I'm talking about just the physical trauma, also talking about the mental trauma happens because of that. So also we can generally classify trauma into a big T trauma and a small t trauma, big T and a small t. So what is a big T trauma? As I listed there, they can be disasters, can be natural disasters, terrorism attacks, bomb blasts, abuse, sexual, physical abuse, assaults. I've treated people who walk on the road and get assaulted by somebody, mocked by somebody. I still remember this one patient I treated. He was traveling on a city bus, and he was stabbed on his thigh by the guy who was sitting next to him. So those kind of assaults, it can cause us a lifetime trauma. And car accidents, I just told you, and combats. These are all the big T traumas. They are more life-threatening. The impact is more pronounced, and impacts our sense of safety. Right, that's very important. Once you lose that sense of safety, it's hard to trust people, and you feel powerless and you feel helpless. So that's where we come in as a physiotherapist, as a first-time healthcare professional, and also as a health coach, the way we communicate to them. We're going to talk about it later in the slides and in the presentation. We'll go there. And the small T trauma. It may not be as big as the big T trauma, obviously, but it can be very distressing, and it can impair your function every day, right? You always think about it. It's always the back of your mind, and it affects you, right? That's your small T trauma. Examples, it's like family conflicts, mom and dad fighting, or brother and sisters fighting, and infidelity in the family, divorce we already talked about, and loss of job. With the pandemic, so many people lost their jobs. People have to close their businesses, right? And we know how many restaurants are closed, and people suffered a lot, and they are all trauma. That's why we are just coming out of the pandemic right now. We have to be a little more careful about dealing with people, because we don't know like the person you are meeting in your clinic and what they went through in the last 2 years, if not something happened before that, just last 2 years. COVID is a pandemic, it's a trauma. So almost every one of us had underwent that trauma. So first of all, are we taking care of ourselves first? Like, are we come out of our own personal trauma to before we treat somebody else's trauma? So we have to ask ourselves as a physiotherapist as well. We're going to talk about burnout and the compassion fatigue later. That's also a trauma. So we have to take ourselves first, right? We can't pour from an empty cup. So that's very important. So those are the things, are small t traumas. So there's a lot of evidence to prove that trauma we go through as childhood affects the brain and the development. So I put the PET scan images here, you can look into this. The effects of trauma, it's in different systems. It happens in the neurological system, biological system, psychological system, and social system as well, right? It can be immediately, it can be immediate onset trauma, or it can be a delayed onset. The changes happening in the brain can be immediate or delayed, right? And also it can be short-term changes, or it also can be long-term changes. So this picture you see that, and there is a 2 PET scan here on my right and the left. On the left is a normal childhood experience. You can see the red areas are highly active brain areas, and there's 2 circles you see there. Excuse me. That is your temporal lobe. You see how much active the temporal lobe is in a normal childhood on my left. You take on the right, that's a brain of a child, a Romanian orphan. We have taken the picture of the brain of that orphan, and you see how much the temporal area, there is no activity at all, because the temporal lobe, that's where all the emotions are being active, all the emotions being created and stored in that area, and you see how underactive that area is. Because as an orphan, you're not getting a lot of love and care from your orphanage compared to your normal childhood with the mom and dad and other family members. So you see the deprivations happening, and what that's going to change. Okay, these children suffer emotionally and with a lot of emotional problem and also cognitive problems. And there is a proof in the pudding. So it's not just we just talk the theory, but there is a proof that that's trauma and also the love affects how our young brain develops. That's the proof here. And also I put a picture of a trauma tree here. Trauma can happen at any level of this trauma tree. You can see it can be a prenatal trauma, which is your roots. When the baby is in the tummy, trauma can happen. We know that too, if there's any substance abuse or alcohol or trauma to mentally or emotionally or physically to the mom, how it affects a child in the prenatal period, that's your prenatal trauma. Then at birth, trauma can happen after the birth. Most of them it's physical trauma. Then when you're infant or toddler, it can happen. When you're early childhood, it can happen. That's your branch of the tree. When you come out, becomes a tree, it can affect a small branch as a teenager, or when you grow up more as an adult. So it can happen any time or any stages of your life. The trauma can occur and it can affect you. So trauma and brain. So there's so much neurophysiology of trauma. I just put 1 or 2 slides here to explain. But you can read up more, and there's a lot of resources out there to understand the effect of trauma on brain. So here mainly 3 things you have to focus here: your amygdala and how it becomes hyperactive in traumatic situations, and also when you relive the traumatic events, how that's become hyperactive. The amygdala is a place, and that's kind of a survival zone. It's wired for survival. It creates a flight response, and how that is hyperactive in the PTSD stages, and also your prefrontal cortex area in there. So how that is mainly kind of reduced in volumes, underactive. So that is where you think, you take logical decisions from prefrontal cortex, and that area becomes underactive. So it's all, your whole things is driven by fear and emotions, but not logical thinking. And the hippocampal area, where responsible for memory and storing a lot of memory and differentiating between the past and present, that area it shrinks. So your amygdala becomes hyperactive, your hippocampal area shrinks, your prefrontal area is underactive. So all these changes happens in your brain, which creates more problem for the person who underwent trauma in their life. So again, the brain development, we already saw the picture of the PET scan between a normal child and the child in the orphanage, how the brain scans are so different, showing the active changes in the temporal lobe. It's another diagram here which shows the trauma and the brain development, how it affects the different parts. In a typical development, you can see survival is a small part because they don't have to worry about it. They're comforted by the love and care in the household, right? And then so they can easily regulate their emotions, regulate the physicality and the cognitive aspect of it. They can be very good social aspect and emotional aspect for the growth of the brain, and then the cognition improves on top of it. And that is on my left hand side, it's a normal typical development of a child. But on the right hand side, you can see when there is a trauma involved in the childhood, it can be an ACE, which is adverse childhood trauma, or any kind of trauma, how that whole paradigm changes, right? A lot of your time in your childhood just goes in survival. You're in the survival mode all the time. You're always fearful, scared. What's going to happen to me? Oh, is this person, I can trust him or not? Am I worthy of living, right? And am I helpful? Or like this feeling of powerlessness and helplessness, it kicks in. You're always on the survival mode, right? And then it's hard to regulate your mind and body, and then you're shrinking your social aspect of your life. You don't go out and mingle with people because of fear, and then the cognitive development also goes down. So you can understand how trauma affects brain development. So now, how it is relevant to physical therapy practice? How is it relevant to physiotherapists? Why I should learn about, why should I educate myself about trauma-informed care, and why it is important for me? This is the relevance, okay? It can be a barrier to your treatment, right? When you treat a patient who has a trauma in their past and which you're not addressed properly, that can be a barrier to your treatment. They may not engage properly in your treatment plan. They may repeatedly miss or cancel treatments, and also they may not do the home exercise program. They may not kind of adhere to your recommendations. So that's when you have to see what's going on. Is there something else is bothering them? Is something else which is not letting them to be compliant with your treatment plan? So that's something to think about. And some people, we always talk about, oh, high need patient, and there might be a story behind why they are high needs. We might have to find that out. Yes, it is draining for the physical therapist providers or medical professionals to sometimes deal with the situations, but we have to educate ourselves to deal with this in a better way. And also a bias, or sometimes we can have unconscious bias. We just put everything on the patient. Oh, he's a very non-compliant patient. I have nothing to do. So maybe we haven't addressed it in the right way. This is something for the physiotherapists, for not only physiotherapists, for all healthcare providers to think about. It can be a doctor, you can be a surgeon, you can be an occupational therapist or speech therapist. Because I'm a physiotherapist, I'm sticking to my scope of practice, and that's why I'm saying a physiotherapy relevance. This can be relevant to all healthcare professionals out there. So now take a moment and reflect, right? So what kind of feelings and beliefs and biases come up for you, right? You can just maybe take a cup of coffee, sit it on your table, take a pen and paper, and just reflect on you, right? I'm 45 years old now. So in my 45 years of my life, what kind of lenses I have developed, and then how I'm seeing other people through those lenses, and what are my biases, what are my feelings, what are my beliefs, right? How does it affect me when I'm seeing somebody as a patient who can be with some trauma, right? Like one thing I can say, because I came to Canada 20 years before, and I lived 25 years of my life in a different country, 36,000 kilometers away, different culture, different language. Then moving on here, I lived another 20 years in Canada, different culture, different ways of living. So you've seen the world from the east and also from the west. So I kind of right in the middle, half of my life in the east and half of life in the west. I enjoy that. I enjoy that because I can see people from both sides in a different perspective, in a different lens. So that I thought that really helps me when I reflected on my own thing. That really helped me in identifying that. And we all can educate ourselves on this. So yeah, you can stop or pause the video now and take a pen and paper, write down, okay, what kind of feelings and beliefs and biases you personally have. And how do you think that affects your practice and how you communicate with your patients, how you communicate with your staff? Because trauma is not only between patients and therapists. Don't forget your colleagues and staff in your organization. There can be trauma among us, one of us too. How are we treating that fellow colleague and the fellow staff? So what happened to them in the pandemic? any loss of life in their family or financial loss, how they are coping up with that. Are they emotionally different and mentally different when they came back after this pandemic, when they came to work? Are we considerate to that? Are we being empathetic to them? It's not only patients, our fellow colleagues as well. Think about it, write it down, right? And just see. You don't have to share with anyone, but it's just a self-reflection. Hope that makes sense. Okay, now you're going into a little bit of trauma. What are the 4 R's of trauma-informed care, right? So the 4 things is, first you have to realize that there is something impact of trauma for this patient, and you have to recognize that. You have to recognize the signs and symptoms what the patient is presenting to you with, right? You have to recognize that. Again, not only patient, it can be a family member, it can be the staff, it can be anybody, it can be a kid, and we have to be able to recognize that. Then respond. How you respond? To respond, you need to be first knowledgeable. You educate yourself on how to respond to people to become trauma informed, and then what are the policies and procedures the organization is having to handle this in place. So that's very important. So first realize, recognize, and then you respond. Then resist we call it the re-traumatization. Yeah, how can we prevent re-traumatization of the patient, the same thing happening again in our clinic or in our practice or for the staff? So those are the things we have to consider as 4 R's of trauma-informed care. There is also nice documentation. It's a 2-page document. Canadian Physiotherapy Association has released as well about this 4 R's and the 6 key principles we're going to see next. There are a lot of toolkits available in different places as well you can use of. Key principles. There are 6 key principles with trauma-informed care. I'm sorry for the busy slide. You can read about it slowly later. If you want, you can pause and read about it later. The 6 guiding principles. Again, this is credit goes to Oregon in states, the Trauma-Informed Oregon. I took the slide from their website for the educational purposes, and credit goes to them. And there is a reference there, right there also with the SAMHSA'S concept there. So first one is safety. So we have to make sure that throughout our organization, our staff and our patients or everybody feels safe in the environment. That's very important, creating that safe environment. Then trustworthiness and transparency. You develop the relationship with your patient and your colleagues that they're able to feel safe and they're able to trust you to share their experience with you. That's very important. And also peer support. When you identify that something is not right with someone, how we can help them to get better, and also refer out or show them the way to address that issues they have. And collaboration and mutuality, right? So it's a collaborative practice. We work with psychologists, we work with massage therapists and chiropractors and other healthcare professionals. Then it's when you're referring patients out, when you're talking to somebody about your patient, you can also explain about this trauma-informed care and how you're handling that. So it will be helpful to have that collaborative practice. So they always say, you don't have to be a therapist to be therapeutic. I'll repeat again. You don't have to be a therapist to be a therapeutic. Because our front-end staff, they also have to be trauma-informed when they talk to the patients on the phone, or the patients first come in, when they talk to the patients to take the information. You have to be a little sensitive and culturally competent to take care of the information, give them information, and guide them in the right way. And that's what I meant collaborative practice. And empowerment, voice and choice. So you have to empower people. And that is the whole point of this Ask Giri, the Physio Show, which I started 3 years ago. That my motto or the vision is to educate and empower people, giving them the value, giving them the truth, and let them decide what's best for them. Then give them the autonomy and give them the knowledge. And I've had so many positive feedbacks. Yes, of course, negative feedbacks too. There's always somebody to give negative feedback. I'm okay with that. When you come into the social media platform, you should be able to accept the negative feedback as well. So just embrace everything and move forward. If one person is changing the way they are and changing the lifestyle, changing the functionality, physicality, emotionally and socially, because of watching your episode, your job is solved. And that's how I go by. I'm not going by how many views I get, how many comments I get, no. And I get positive feedbacks from a lot of people, and that's good enough for me. I'll keep going as long as I can do this, right? And if you want to check out the previous episodes we have done, go to physioshow.ca and sign up, and you can see all the episodes are archived there for the last 3 years. Coming back to the topic, cultural, historical, and gender issue. As I said, you have to be culturally aware of what the patient's background is. Did they come from a country who had a war? Did they come from a country who had a national disaster? What they went through, how the families are disintegrated, where they went and how they suffered. Did they get a job as soon as they come in as an immigrant to this country? What are the sufferings they went through? Are they being discriminated because of so many reasons, race, religion, color, whatever it is? You have to ask those, you have to be aware of those things to deal with them. I mean, gender issues and address those things, right? Develop the relationship so they feel safe and they trust you to share that information. So that's all I ask for. So these are the principles we talked about in the previous slide. I just put it down in the letter format here, and being like, create the safe environment and create the trustworthiness and transparency, and also be empowered and be a voice and a choice for them, collaborate, and also culturally, historically, and gender issues you have to address, and peer support is very, very important. Okay, and you can pass the slide and read through everything. And also, as an organization, we have to include policies and procedures and advice. Even in the last staff meeting, we discussed with all the staff about trauma-informed care. Everybody is going to take courses. Already some of them is done. And so that this is kind of a collaborate, everybody involved in this to make the clinic as a trauma-informed physical therapy practice. And we are very proud that we are going in that direction in this world we are living in right now. So ways the physio's care can activate patients with trauma history, right? So they had trauma in the past. The things we do in the clinic normally every day, how that can activate that emotion again, for them to go through the reliving that or re-traumatize themselves. We have to be careful about these things. Number one, lack of privacy, right? Especially when they're taking off the clothes and everything, make sure we close the curtains properly, or when you identify these patients are underwent trauma, give them a private room if possible so that they feel safe in that environment. And also what type of personal questions we are asking and how we are asking those questions, that's important. And taking a full consent, written consent and verbal consent when we do invasive procedures. Like we as physiotherapists, we do dry needling, we do what you call the IMS and acupuncture. They're all invasive techniques, right? And we have to make sure, we have to be very cautious about it. We, especially the people with underwent trauma in the past, right? Once you identify that, so be extra cautious about it. And even physical touch itself, someone who underwent a lot of domestic abuse or sexual abuse or physical abuse, touch itself can be traumatizing for them. So we have to be very careful. I have dealt with some patients who underwent a lot of childhood trauma. When they come with their caregivers, they inform me. So the way I handle them is very important. Extra cautious before I do any physical examination or physical manual therapy. So we have to be careful about physical touch as well. And also positions, vulnerable physical positions. As physiotherapists, we know, like we put patients in all different positions to manipulate this or manipulate that, and we have to be a little bit careful about this. Sometimes as a physiotherapist, some of the positions we have to put our leg on top of the bed, get some closure, go closer to the patient to do some manipulations and stuff like that. So we have to be a little bit careful about that, how we are positioning ourselves and getting the proper consent. That's very important. And all the relationship between patient and the provider, the power, right? And we have to share power and we have to take shared decisions. We cannot say, I'm the healer, you are the patient, I'm going to tell you everything what to do. That's not how it works, right? So it has to be shared decision and also shared power in there. So the references, these are the characteristics, the references from this, that website I've given down there, the slide presentation. So these are things I took from there. You can refer out more if you want to. So how to create safety in our practice. That's the next slide here. So, and a very nice saying out there, I put it in the green on the top here, you can read, the ability to feel relaxed in one's body requires the emotional experience of safety. If you're not feeling safe, you're not going to feel relaxed, right? You can see some of the people, after a motor relaxant, you try to work on them in the neck, how the whole body stiffens up, they cross their leg and they're not comfortable, they're not feeling safe. So I just stop the treatment, ask them to relax, use some relaxation techniques, use some breathing techniques and talk to them, make them comfortable, then start again. Don't just push through the things because you have no time. So that's very important there. Positive rapport and trust, you develop that. Communicate very clearly. It's nothing wrong in making sure to keep on addressing how they feel, during the course of the treatment. It's not only that you get consent in the beginning and then you just keep going. No, in between, stop and have a minute to ask them, are they feeling okay? Are they feeling safe? And is there anything they have to change? Anything they want to ask about, right? And validate their consents is very important. And also body language, you understand that. Sometimes they may not say, but based on the body language, you would know that they are not comfortable. We all know that. Then how we have to change according to that, right? And make sure we treat them with dignity, respect, and validation, right? And especially with people when you get in the clinic who doesn't speak English very well, or English is their second language, right? We cannot right away start with the bias, right? You all know, what is English? It's just a language. English is not a sign of knowledge. A lot of people tend to forget that. Oh, he can't speak English. Doesn't mean that he does not have knowledge. It's just a language. Do you know how many languages this guy can speak? Maybe he come from some country X. Maybe he can speak 6 languages from his country. Unfortunately, he just cannot speak English, that's all. And he's trying his best to learn that, right? So do not think that way and do not form that bias already, right? Yes, it's going to be a little difficult to communicate with them. We have a lot of other ways. Everybody understands human emotions, right? You don't need language for emotions, right? So I just want to put that tag in there. When you treat a patient who doesn't speak good English, just treat them like properly. So don't have that bias, right? Because I repeat again, English is just another language. It does not measure knowledge. Okay, let's move on. The language matters, right? And how we talk to the patient, and that's very important. And we're going to talk about some of the sentences in the next slide, right? We have to be very mindful of our words, what words we are using, and the tone of our words is very important, and how it is being phrased. That phrasing of our sentences. You have to be slow down, you have to be relaxed, you have to be having a soft tone when you deal with the patients. You can't be very agitative and fast and rushed, and you got to sit down and have a high contact and have a very nice conversation with them, right? And also avoid using languages which is very judgmental and very disapproving, right? And you have to use that one. And also, I put some examples there. Then we can't call the patient non-compliant or unresponsive or resistant when we don't come across properly. So hope that makes some sense for you, and some ideas to creating safety in our practice. So language, what are the different languages we use in the clinic and which matters in our practice, right? So these are the things which really can open up some channels for you. Would you like me to connect to someone who want to talk, you want to talk to? Like, it can be your psychologist in your clinic or psychologist outside who you can refer them and they feel comfortable to talk to, right? And also, let me know how can I make you more comfortable in this, whatever, when I take care of you in the physio clinic, right? You can always ask that question. And also, when you're working on them, we can also ask about, please let me know if something doesn't feel right for you. Right, that's important. And also thanking them for trusting us to provide you this best care in these tough situations and private experience, right? So that's very important. So trauma care education, how a physiotherapist or any healthcare providers can educate themselves about trauma-informed care. There is tons of free resources in internet, really good ones actually. A lot of toolkits on so many different places. You can check it out, educate yourself. Basically, actually, Alberta Health Services has a course on our trauma-informed care, which is available to everybody free. You take your time, half an hour to 1 hour to do that courses. You can also get certification for that. I did that, and I told my staff to do that also, so you can educate yourself on the trauma-informed care, so you can be very sensitive to cultural and ethnic characteristics later. And I put some references here. You can check it out here, and lots of free courses out there as well. Restoring balance as physiotherapists, how we can restore balance with this people who had trauma in the lifetime, right? Top-down regulation is mainly how the mind is engaged to change the brain, how the mind affects the body. So sometimes it's good for you to have a mindfulness, a practice with mindfulness, I would say. That's something we are trying to achieve. So what is mindfulness, right? You might ask, it's not yoga, it's not meditation. Mindfulness is nothing but intentionally paying attention with kindness. I'll repeat that again. Intentionally paying attention with kindness. That's all we have to do. and it can be done by everybody in your practice. It just needs a little bit of education, that's all, and you can have a very mindful practice. And so this top-down regulations, if you have to refer to a psychologist, you can do that for them to have that talk therapy and CBT and all those things. Maybe is there more their cup of tea than our cup of tea, we can refer out. But when I come to bottom-up regulation, we come in a big way, right? How we kind of create that through the body sensation and other things like, exercises. Exercises can secrete so many happy hormones and opioids in your brain, which can deal with depression and other things. Exercise is the best antidepressant ever out there, and a lot of body scan techniques, Jacobson relaxation techniques, box breathing exercises. Patients can learn from you. And also my last episode was about vagus nerve. That one powerful life nerve, how it affects all your stuff in your body, like your heart rate, to blood pressure, to emotion, to digestion, to everything you have in your body. If you haven't watched that episode, I would strongly suggest you to go back and watch that episode. It's called Welcome to Vegas, and we talked about that, because some of the techniques we teach these patients who underwent trauma is also ventral vagus stimulation stuff. And I went through some exercises as videos in that episode, which you can use for these patients to help them out when they are very anxious, when they are emotionally, mentally dysregulated, and how to regulate them, how to calm them down using some vagal nerve exercises. So please go and watch that if you haven't watched. I'll really help you in your practice to restore balance in a patient who underwent trauma in their either a childhood, adulthood, whatever the walk of life it is. So you have to refer out when needed. It's everything we cannot do. That's where the psychologists come in, psychiatrists come in, other health professionals come in. You have to seek consultation and supervision. Take them out and also fill them in about this patient. Give them whatever you can give them so they can take a good stand on this patient and treat them. Very, very important. Or if you are a physiotherapist and you're not comfortable treating with a patient who underwent a lot of trauma in their life, refer to other physiotherapists who are trained in a trauma-informed care. That's very important. And also we can teach patient a lot of self-care strategies, right, to help them. So I listed a bunch of them here. It can be a spiritual self-care strategies like prayers and meditations. It can be people support, ask them to go with the support from the family and the friends and the peer groups, right? So I already always include this question in my assessment actually. Once I finish all my subject examination, I wrap with my subjective examination with this question like, what do you do for fun? I ask this question to my patients, right? Just want to know their social life. I just want to know what do they like, what do they don't like, and how the social life is. You know what? In the last 2 years, because of the pandemic, a lot of people's social life is affected quite a bit. And as a health coach, and it's your job to encourage them to involve in more social activities, right? And you open up that chapter once they develop the relationship with you, and also during the assessment, you have to ask that question as well. And mental and emotional self-care, how they are taking care of it, right? How much risk they are taking, how much self-care they are doing, right? And lifestyle modifications. As physiotherapists, you are very versed to know the patient's lifestyle and what modifications they have to do to get better, right? And how much time they're spending time outside, how much time they are on the screen. And also self-care physically, that becomes more like nutrition and also sleep and hydration, breathing, mindfulness, movement, how much physical movement is happening in their body, how much exercise they are doing, and how can we create an exercise program they can comply with. Even though if you have only 10 minutes every day, how we can create a program for them so they can engage in that, and how we can positively motivate them to do something, right? And it's not all structured exercise, also how we can motivate them to be physically active outside of these exercise zones, right? So that's where we come in as a health coach. And also I put a small self-care checklist here, and again I put the place where I took it from there too. So things like that. Beyond that, play with your kids, get on the floor, be barefoot, move your hips nicely, and have a gratitude list, breathe nicely, sleep well, put your phone away, and give yourself some nature walk. We call it a forest bath. So all those things you can do. And coming to the point, as a provider, as a physiotherapist, or as a healthcare provider, how to take care of yourself from the burnout and the compassion fatigue, right? Like burnout, like because we just always, it can be a problem from a co-worker, or it can be economic insecurity, your caseload might have gone down in the pandemic, you're rebuilding your caseload, or some misunderstanding with the owners, or things like that, or diminished control. So these all can cause burnout. How to take care of yourself? Are you emotionally exhausted? Have you taken any help? Have you talked to your colleagues, your family members, your psychologist? Have you done enough time outside? So those things we have to ask, right? And compassion fatigue. We know what is compassion fatigue. When we care for others, sometimes we need help too, because we are always taking the burden of everybody's stress into you. And we have to make sure that we are taking care of that part also. So we have to take away our negative thoughts and everything. And we have to be, as I said before, like only I can pour from my cup if my cup is full, right? I cannot pour from an empty cup. So self-care is not selfish, guys. As physiotherapists, we have to take care of ourselves, because we are providing so much care and health to others. We have to be healthy emotionally, physically, spiritually, socially, mentally, everything, you name it out there. So make a list of that too for yourself. It's not only all about others. You have to take care of yourself as well. So reflection, another small thing for reflection now. So based on all these things what we discussed so far, what's the one thing you will continue doing? Right? As a patient, as a physiotherapist, as a caregiver, as a family members, what the one thing you'll continue doing, what you're already doing, and what one thing you will change moving forward, right? To kind of get that trauma-informed lens to see your practice, to see your patients, to see your colleagues, to see your staff, and also to see your family members. So how are you going to incorporate this in your life? Just as a good reflection point in there, right? That's what I want to talk about. So these are the reference sources I referred for this presentation. You can go and check it out there. And if you like this presentation, you think it adds some value to somebody, your friend or family, or even your fellow physiotherapist, and please share it with them and like and comment about it. It's going to be on YouTube. It's going to be on Physio Show website. It may be coming on Facebook as well. And I'd love to hear from you guys. And the whole objective is, so you are trauma informed as a patient, you're trauma informed as a therapist, as a family member, to help yourself and help others. Until I see you next, bye.